I think we've come a long way in the last 8 years. 8 years ago we had 12% unemployment or so. We'd lost a lot of jobs. We've come a long way. Our goal is to take us to the next level. If you look at the challenges, I think there are a couple. One is a skills gap, or not matching skills with people, and we've got to do a better job in regard to that. I think a component part of that is early childhood development. We're going to really invest in early childhood development, particularly among our poorest of our children. The other big problem is the drug problem. We have a lot of people who frankly cannot be employed or grossly underemployed because they can't pass a drug test, they can't take care of their family. Just a huge tragedy. So we have a 12-point plan that we will implement as soon as I take office.
What do you see as the challenges facing the next governor?
I think that we have a lot to do to spread out opportunity more fairly across the state. I also think that protecting and supporting health care, which is very much in the minds of Ohioans these days, is a key difference in this race between myself and Mike DeWine. I'm supporting a plan that would reduce health care costs for Ohioans and provide more reliable coverage. He, of course, his signal act of being Attorney General was to try to take away protection for people with pre-existing conditions and try to wipe out the Medicaid expansion around the country. Fortunately, he failed in that effort, but if he'd had his way, nobody in Ohio with pre-existing conditions would have any certainty about their insurance coverage, and we would not have Medicaid expansion in this state.
Can you state unequivocally that you would work to maintain what has been the Medicaid expansion?
We will keep Medicaid expansion. We want to make it sustainable in case, for example, the federal government decides instead of paying 90+%, that they're going to drop that down to a much lower figure. We want to do everything that we can to prepare for that day if that day ever comes. 7 different times I voted when I was in the United States Congress in favor of covering pre-existing illness.
But look, his comments on that don't pass a straight face test because actions speak louder than words. He says he's for it, but when he had actions to take, he acted against it. He tried to wipe it out. There's still a lawsuit about pre-existing conditions in federal court in Texas. He could join it and protect pre-existing conditions, but he refuses to do so. So to say you're going to do one thing, but have the chance to actually do something about it and fail to do so, I think tells people exactly what they need to know.
The state's rainy day fund is close to $3 billion. Sounds like a lot, but in a $70 billion budget that could be gone in a blip. What would it take for you to tap into that?
Well, I think we'd have to have an economic downturn that would be significant. But I also think that we continue to run surpluses in the state of Ohio at a time when we're pulling money out of local communities across the state. I think that's the wrong approach. And what I will do is support our small businesses, fire up our infrastructure in the state, that's good jobs all over the state, and bring back that money to our local communities so it can circulate here and help support our local economies.
In what case would you ever tap into that?
Well, I think a rainy day fund is there when we hit a recession, when we hit a pretty significant bump in the road. And the whole idea is so that we can get through that without dramatically slashing services, slashing money for kids who, for education. That's really what a rainy day fund is for. The governor has filled that pot. And so, that's how I see the use of it.
The Supreme Court in June cleared the way for sports betting in states across the country. Several surrounding states either have it or will soon have it. Governor Kasich has pretty much punted to the next administration. Where would the DeWine administration stand with this?
Look, I'm not a big fan of betting, but it is a reality, and Ohio voters have made that decision. With the casinos and other things throughout the years. And so it's here. I think it's important for Ohio to do it right. And so I will work with the state legislature when I'm governor to make sure this is done right, make sure that we can control it, make sure that we can regulate it. But it's coming to Ohio whether people want it or not. And so we need to be there to do it right, the right way.
How will a Governor Cordray proceed?
I think we need to proceed with sports betting in Ohio. It's already happening in Ohio. We all know that. It's just a matter of making sure it's regulated and making sure we get revenue from it. States around us within the course of a year will all have sports betting. We can ill afford to be left behind in Ohio.
Every poll just about shows this race as being neck and neck within a point in many of them. Given the Republican gains, successes they've had in the past 12 years, why do you think that is?
I think that this race is tight because people around Ohio are thinking hard about the need for change. And I think that we have growing momentum as a result. When I talk about my approach to protecting health care and contrasted with what Mike DeWine has done to savage health care in Ohio, I mean, that's a gaping difference right there. And people also want to know that their state government is going to be effective for them. It's going to be effective not just for those at the top, which are the ones who support DeWine and have supported his campaigns, but for the middle and working class of this state.
Why do you think that this race is tight?
You know, this is an open seat for governor. I think when you go back, historically, open seats for governor or where there's no incumbent are usually pretty close races. So we have expected a close race all the way through. We've not been disappointed. This is a very close race. We think we're going to win. You know, we think we have the vision for the future of where we need to take the state of Ohio. I mean, I'm very excited about the prospect of serving as governor, but I'm, you know, at this point asking for people's votes and telling them, you know, what I want to do with the state.
Another attack leveled against you has been on overtime pay. You blocked a lawsuit, or you had a lawsuit to block changes by President Obama. Is that something that you would pursue as governor?
Look, this is something that came up because of what President Obama was proposing and had done. It was a real killer of small business. We would have lost a lot of jobs. And I talked to a lot of small businessmen and women, and it would have created a big problem. That's why I took that position.
What about right to work? Is that something that you would pursue?
Right to work is not something that I'm going to pursue at all. I think that we have good labor relations in this state, by and large. I think that we're all in this together. I don't want to divert from our efforts in regard to the drug problem, our efforts in regard to education and filling the skills gap. Those are big things that I think if we do them right and we continue to move forward, we're going to have an economy that's going to be even going faster than it is today. Look, we still have people who have been left behind, but we're doing a lot better than we were 8 years ago. And my goal is to take us to that next level.
He says he will not touch that and he will not pursue right to work.
On right to work, he said 4 or 5 different things over the course of this year to different audiences. He says he's against legislation, but he said he would like to have it on the ballot. Now he says that's not on his agenda, but the same thing was said by governors in neighboring states who later supported and brought right to work to their states. Ohio is not a right to work state, should not be a right to work state. I will veto and oppose right to work in Ohio.